Here we go. This is our Choose PT project. Our authors are Ben Rogers, Belle Moody, Jacob Shipper, Macy Replogle, and myself. Okay, so just a little introduction here. So when the majority of patients with musculoskeletal pain seek health care, usually healthcare providers are going to give them something that's not aligned with the best practices. One of these examples would be initial management being opioids. And unfortunately, the risk of transitioning from opioid naive to chronic opioid user for newly diagnosed musculoskeletal pain patients was highest for people with low back pain or with multiple areas of pain, which we know a lot of the U.S. suffers from low back pain. Non-pharmacological methods to treat low back pain have been recommended since it is being proven that opioids do not significantly improve health outcomes in individuals with low back pain. And of course, one of these non-pharmacological methods is physical therapy. It's been shown to be effective for chronic pain management, but there's a gap in research examining the role of PT for chronic pain and opioid reduction. So hopefully this PowerPoint will answer some of those questions on how PT can help this patient population. So just some fast facts about opioids. Like I said earlier, a good bit of the U.S. Suffers from chronic pain. Approximately 20% is the number that we have here. As of 2016, studies show that non-pharmacological treatment for low back pain is actually being recommended less. Only 12% for physical therapy, 19% for exercise therapy, and 9% for psychological therapy. In the U.S., opioids accounted for 18.8% of medication prescriptions for chronic low back pain, and 76.9% of those prescriptions were for long-term use. So we can see where that's a big issue. In a study that compared long-term opioid use and physical therapy management after arthroscopic hip surgery, only 1 in 5 patients were prescribed physical therapy without additional opioid management after surgery. So opioid is basically the U.S.'s answer to any form of pain. So the main problem we're seeing here is that there's a complex history of opioid use disorder, substance abuse history, and pain management in the United States. Standard of care has historically been a pharmacological approach that heavily included the use of opioids. The CDC is now recognizing that long-term use of opioids is not the solution and leads to opioid use disorder, overdose, and accidental injury. So it's very vital that we come up with non-pharmacological therapies such as PT to treat this patient population.
Another important component of this presentation is healthcare costs. So individuals with musculoskeletal pain, such as low back pain and hip, who chose PT first had significantly lower healthcare costs compared to those who chose medical care or pharmacological options initially. This led to decreased costs in imaging, decreased out-of-pocket costs, and decreased pharmacological costs. So patients who chose PT as the initial treatment had significantly less hip-related healthcare costs over the next 2 years. Also, it's important for us to help our patients break that never-ending cycle of unnecessary healthcare costs on treatments, imaging, prescriptions, and any other healthcare costs. So, a happy patient and family equals less money spent.
So one particular study that we looked at compared downstream effects of opioid use to physical therapy management in patients following an arthroscopic hip surgery. And they had several interesting facts about long-term effects of opioid use. So that's what we're going to look at here. Basically, they presented 4 different groups of people. One that had only opioids following the surgery, one that had only physical therapy following the surgery, and then one that had opioids before physical therapy following surgery, and one that had physical therapy before opioids. So those are the groups I'm going to be referencing with these facts listed below. Patients who were prescribed opioids without PT following surgery were more likely to have another hip surgery. And then physical therapy was not utilized until 8 months after surgery in patients that received additional opioids before physical therapy. Patients that received physical therapy first began therapy only 43 days after surgery. Patients who received opioids prior to physical therapy had a larger number of opioid prescriptions and had longer day supplies of opioids, and also were more likely to use opioids chronically. Finally, patients who received opioids prior to physical therapy had significantly higher rates of downstream opioid use, which can present a large issue.
So why don't physicians refer to PT? So really we believe that there's a large disconnect in the healthcare field, and many physicians don't really know much about PT or the full extent of what PT has to offer. like pain management techniques. One study we looked at showed that primary care physicians are referring between 7 to 20% of their patients that come in with low back pain, and are referring only 13.6% of their patients who present with knee osteoarthritis. Another study also said that 21.5% of patients with chronic musculoskeletal pain were given prescription for opioids, while only 10% of patients were given a referral for physical therapy. And we're starting to see a lot more chronic low back pain patients coming through the healthcare field, but there has not been an accompanying rise in the referrals to physical therapy. We've actually seen a decrease in some areas of physical therapy referrals, but there's been an increase in the amount of opioid prescriptions. The good thing is there are promising statistics for this, as physical therapy facilities are now being co-located within primary care facilities. And in those areas where the physical therapy facility is in the same building, we've seen a 12% decrease in the amount of opioids prescribed, as well as a 9.6% decrease in the visits to the emergency department. So the solution to this problem is non-pharmacological treatment, as that's the most recent practice guidelines. Physical therapists will be one of the leading providers for this type of treatment. So some of these pain management techniques for physical therapists will be like exercise, transcutaneous electrical nerve stimulation, manual therapies, and physical agents like BioFreeze, Icy Hot, or other modalities, hot cold packs, game readies, or etc. 4 different studies that we looked at showed that physical therapy utilization actually decreased the chances of receiving an opioid prescription. And then in one of the studies we looked at, it compared the effects of PT versus opioid therapy for arthroscopic hip surgery. And with that, physical therapy ended up with fewer opioid prescriptions, and a smaller percentage became chronic opioid users because of that. Another one compared physical therapy and opioid therapy, and the physical therapy group had decreased total health care cost, as they did not require continuous prescriptions. So the goal of non-pharmacological treatment approach is not to completely eradicate the use of opioids, but it's really just to allow for multiple pain management techniques that do not come with the harmful side effects of addiction. The future of pain management shows strong indications that non-pharmacological treatment will be at the forefront of treatment approaches, and if this is the case, we may have to change the infrastructure of the healthcare industry in many components, including like new delivery models for healthcare, new evidence-based studies, and new payment policies and systems that support non-pharmacological treatment approaches.
Additionally, there is evidence that has evaluated how patients' history and comorbidities have affected their likelihood of receiving a referral to see a physical therapist, as well as their likelihood of following through in participating with physical therapy. So as you can see below, here are some statistics regarding such evidence. Those with a higher number of comorbidities were less likely to receive a referral for a PT evaluation. So if they had diabetes, hypertension, more comorbidities, they were less likely to actually be sent by a doctor to go see a physical therapist. Those who were tobacco users were also less likely to receive a referral for a PT evaluation. If a patient had received a radiograph initially, they were more likely to participate in physical therapy. If a patient had had a high number of comorbidities, so back to that first statistic, if they had diabetes, hypertension, multiple comorbidities, they were more likely to participate in physical therapy. If a patient had received a non-opioid prescription initially, they were more likely to participate in physical therapy. Please see below our list of references and the evidence we used to compile all of this information. I hope you enjoyed our presentation and you use the facts that we've presented in your clinical practice in the future.